We begin with the MERS situation here in Korea, with the number of infected now at 179. Let's go straight to our Kim Ji-yeon, who joins us from the news center.
Yeon, health authorities have been releasing a cautious optimism over the outbreak, saying it's kind of saying that the worst is over, but they're now saying it's still too early to say that.
Well, Chia, the situation now suggests the outbreak is at a crossroads. 4 new cases were confirmed earlier today, and among them are patients who are not under quarantine orders or home isolation, raising concerns that there may be more cases that are still under the radar. One of these new cases involves a 51-year-old who had apparently been in the same hospital ward as patient 76, who died from the disease earlier this month. And because of this, Konkuk University Medical Center in Seoul has decided not to receive any more patients for the time being. The Seoul metropolitan government is also taking steps to get a handle on containing the virus.
We're expecting more than 1,000 to be placed in home isolation. In initial monitoring, 13 people said they were experiencing symptoms.
And as for the Samsung Medical Center in southern Seoul, it has decided to extend its partial shutdown after another patient there was confirmed with MERS. The hospital, considered as an epicenter of the virus, has not taken any new patients for nearly 2 weeks now. And the MERS response team in the city of Pyeongtaek, Gyeonggi-do Province is also strengthening its monitoring systems after a confirmed patient who was not placed under quarantine or home isolation was found to have been in public for 6 days after showing symptoms. The province says it's also installing more than 14 thermal cameras in major subway stations and elementary schools.
Well, Jian, many experts and health authorities in here are saying the virus is on the decline. What seems to be the reasoning behind this view?
Well, not only are they pointing to the fewer number of cases that are emerging daily, but also the growing number of patients that are being cleared of the virus and discharged from hospitals. And these two factors have somewhat calmed fears about this deadly virus that has no vaccine or cure, and the number of those who have recovered has steadily increased to 67 people so far, which is more than double the number of MERS-related deaths in Korea. And in regions outside of Seoul and Gyeonggi-do Province, a number of people are expected to be released from quarantine or home isolation as their 2-week incubation period is almost over. In the city of Daejeon, the Konkuk University Hospital and Daecheong Hospital are expected to lift lockdown measures by Friday, as no new patients have emerged during its 2-week incubation period. And in the southernmost island of Jeju, 13 people have been released from home isolation, while 43 others are expected to be released tomorrow. Back to you guys.